Hi, I'm Elizabeth Buller, President and CEO of Scarborough Health Network. I'm happy to bring you greetings from the ancestral and traditional lands of the Anishinaabe, Haudenosaunee, and Huron-Wendat nations, and the territory covered by the Williams Treaty in which our Scarborough Health Network is located. On behalf of all our frontline and medical staff, I would like to express gratitude for the contributions of our Indigenous community here in Scarborough and the many ways Indigenous culture is helping to shape who we are at Scarborough Health Network. Megwetch. June is National Indigenous History Month, with National Indigenous Peoples Day celebrated on June 21st. As a community, we celebrate this special day, honoring the significant contributions of First Nations, Métis, and Inuit peoples of Turtle Island. Every year, we as a hospital community gather together to celebrate the National Indigenous Peoples Day with smudging, drumming, dancing, and traditional food. In light of the pandemic and restrictions on large gatherings, we won't be celebrating in the same way this year. Instead, I'm happy to join with some of our healthcare institutions to bring greetings to you. This year's theme of connection is especially relevant as so many of us find ourselves searching for those bonds that keep us tethered together and give us hope for the future. At Scarborough Health Network, we are one connected network with our shared values of compassionate, inclusive, courageous, and innovative care. We are dedicated to engaging and supporting Indigenous communities and leadership. As part of our diversity and inclusion awareness and training, a number of our leaders and frontline staff have completed Indigenous cultural safety training. I've had the pleasure of participating myself and have truly valued the opportunity to learn more about Indigenous history, principles, ways of being, and health disparities. We continue to offer Indigenous cultural safety training across our health network and have incorporated education on Indigenous health into our Health Equity Certificate program. At SHN, we have a number of staff and volunteers who come from Indigenous traditions, whose contributions are a part of making our community stronger. Dr. Jason Pennington, a general surgeon at our General Hospital, is a true example of this. He received the Thomas Dignan Indigenous Health Award from the Royal College of Physicians and Surgeons. In 2019, Dr. Pennington received the Miriam Rossi Award for Health Equity in Medical Education, the Faculty of Medicine from the University of Toronto. We are certainly better connected thanks to the contributions of Dr. Pennington and other leaders with similar heart and vision. Indigenous culture has also been integral to the development of numerous new programs, policies, and events at SHN. This includes providing spaces and support across our health network for performing smudging ceremonies for patients and their families for spiritual healing. Collectively, these practices and activities facilitate learning and connection building throughout the year. At Scarborough Health Network, we're pleased to join in the celebration of Indigenous peoples and thanking those who contribute to our diverse and inclusive network. All of us benefit in so many ways from actively listening to Indigenous voices, incorporating Indigenous perspectives, and continually engaging with members of our dynamic Indigenous community. Megwetch.